So my advice to new physicians using Nodify is use the test, right? So, you use it once and you get a result that maybe doesn't make sense to you. Don't abandon the test because no test it offers 100%. This is pretty close to 100%, but not quite. So my recommendation would be to just continue to use the test for each of your nodules. And if I had $1 million to bet you, I would bet you it will change what you do. I can guarantee you there'll be at least one patient that your prior decision before the test, or even the decision that you made in conjunction with the test, will be modified. And so I think that's a great thing to know that that modification is only to make it more helpful for your patient and your patient outcome, right? So I think you'll be very pleased with those if you just stick with it.
My main recommendation, which is what I say to every new physician, is, just take a period of time and send it consistently. Don't pick and choose. Just send it consistently for a period of time. Get your results, analyze your results, go over your results with someone who can explain them in detail. And then you can make your decision on your own.
When I talk to a new physician that is using Nodify, I strongly encourage them to utilize the Biodesix reps and more experienced physicians who have been using the test for longer when they're interpreting the results. It's really easy to misinterpret the results, not because they're presented in a difficult to read manner, but just how it should affect management. For example, one of my colleagues at work, when they ordered Nodify for the first time, they had an XL2 result that went from a pretest probability of 50% down to an XL2 risk of 30%. On that basis, they canceled the biopsy and went to surveillance because in their mind they thought, oh, reduced risk, we shouldn't biopsy this right away. Sure enough, that nodule grew in 3 months and they pursued a biopsy and it was malignant. When they showed me the case, they said, John, how come Nodify was wrong here? I said, it wasn't wrong. First of all, Nodify doesn't tell you whether or not you have cancer. It's a risk stratification tool. And in this case, yes, it told you that the risk was a bit reduced from the Mayo Clinic calculator, but it was still substantial. Unless that risk decreases to less than 5 or 10%, it's not worth changing management over. I think the other thing that providers struggle with when they are first getting started with Nodify is who to use it on. So they see patients in clinic and they try to have this very pensive thought process about whether or not they should use Nodify. I would argue that if you are going to introduce selection bias into the decision-making algorithm about when to use it or not, you're going to diminish the value of the test. If you want to experience the same level of discernment that we saw in the Panoptic study and in the Oracle study, then it's important to not introduce selection bias. If somebody meets criteria for the test, it should be utilized. And when you have that level of consistency, that's when you can develop a very efficient system.